advanced degrees in counseling, and that's okay. Most people don't need that. They just need to know that someone is there for them. And then discuss with the individuals in your life that have personal experience with this. Like, how did somebody fail you in the past, and what can I do differently, and what, if you could ask for something, what would it be that you need? Because a lot of us are told, it's okay, you're gonna be fine, things will get better, and instead of validating those feelings, you're just kind of shutting that person down and saying that their experience isn't valid. So saying, I'm sorry that you're going through this, and I will be there with you, oftentimes is a lot more helpful than trying to tell them that everything is going to get better. And then there are some resources on here. So Look Up Indiana. It's lookupindiana.org. It is run by the Lutheran Foundation, I think?
Correct.
Okay. I didn't put it in my notes. But Look Up Indiana is great. I use it all the time at work. It is a website where you can go and pick, you know, I need treatments for depression, I need treatments for anxiety, I need counseling services, I need a psychiatrist, and filter, and it filters through all of Indiana. You can filter it by zip code, and you can find services that you need, and there's addresses and phone numbers. So there's all these different things, and then you can just kind of go through and find what you need, which is nice, because a lot of us just don't know where to turn to begin with, other than maybe our family physician, and a lot of family physicians may not be as experienced with this either, because it is something that family practice sees all the time, but we have a tendency to just refer out to psychiatry, and then you see somebody in like 6 or 8 weeks, and you may need something this week.
Victoria?
Yeah.
I believe it's October 3rd. I know my cell phone would be, so I can't tell you the exact date. But Look Up Indiana is having an all-day event at I believe, anyway, an all-day event here in Fort Wayne. And one of the speakers is going to be Mrs. Rick Warren. She will be there, as will be other speakers, nationally renowned.
Is it October 7th? It's a Monday?
That is correct.
Okay. It's October 7th. It's a Monday.
Yeah, and you can still register for it. There is a fee attached, but it's well worth it if you are interested in something like this.
And I will be going.
It's an outstanding event. Yes.
It's at the convention center, isn't it?
I'm not sure.
I think it is.
Yeah, I believe it is.
Yeah.
But all the information's online. I don't want to misstate anything, but just to tell you,
yeah,
you can go to the Lutheran Foundation .org, and they will. All the information's there for you.
Yes, and I'm going. That's why I know what day it is. It's my phone. Cross Connections is another service that is really good. There's professional Christ-centered biblical counseling, different trainings. They are very active within our community. I have a couple friends that volunteer there. The Lighthouse is another organization that my husband and I have started to be personally involved with as well. And it is a recovery center, and it's very cool because they don't take any money from the government, so they are able to really use Christ and the biblical teachings to help with healing. And they don't have a like 6-week program or a 12-week program. It is you stay there and you live there as long as you need support. And they do drug testing once a week, and they make sure that you're actually recovering, starting to help you get a job and help you reintegrate back into society. But he refuses to take any money so that he can continue to also minister to anyone who's living there. Hope Alive provides support groups, counseling, and transitional housing to help women. So they're kind of partnered together. NAMI is the National Alliance on Mental Illness. There's a Fort Wayne chapter. They are really big in Indiana, so there's lots of support groups there. And then there's just some other information. If you want the names of these, there's some books and some videos that are listed that are kind of Christ-centered,  ways to help with mental illness. And then lastly, 10 ways to look after your own mental health. Talk about your feelings. If we don't talk about it, nobody knows to help. And talking is cathartic, so just actually being able to get out there and talk about it. If you don't talk about it and I don't talk about it, we're all going through the same thing, and everybody else seems to think that everybody around them is not going through it, but we are all struggling, and we often feel like everybody around us is doing better than us, and it's really not the case. Everybody struggles, and if we all talked to each other and reached out, there would be much more support. So physically staying active, we talked about eating well, getting the nutrients that you need, taking a break. We're all so focused on what I have to do today, what I have to do this hour, what I have to do tomorrow, next week, all the things, and sometimes we just need to sit with ourselves and be quiet, take a 15-minute break, and just reflect on what we could be grateful for, and that, you know, we are alive, and that there are things to be grateful for. So just unplugging for 15 minutes. We're all way too attached to technology. We're all way too attached to phones, the internet, television. Like, just unplug and be quiet with yourself. Drink sensibly. So alcohol and other drugs, of course, do affect your brain chemistry, the way that you think, the way that you feel. So if that is something that you notice that you're doing more often, kind of check in and say, how does this make me feel? Why am I doing this? What could I be doing differently? So keeping in touch with family and friends, do something you're good at, having hobbies, getting out, talking to other people. Most hobbies come with interaction with other humans in some form, even if it's just going to the store to buy your art supplies, you're out and you're doing things. Asking for help and caring for others. So making sure that you're reaching out to that person, that neighbor, that friend, somebody that you see that might be struggling, and then accepting who you are, which can be very difficult for all of us. But God made us and made us the way that we are, and you know, being okay with that takes a lot. So, yes.
You mentioned NAMI, and I just want to say, I have a family member who is married to a schizophrenic, and they went to NAMI together, and he learned to recognize the signs when she needed help.
Yes.
And that was invaluable.
Yeah.
Because he knew what to watch for.
Right. And that is very common. So people that are living with mental illness, she was talking about schizophrenia, oftentimes they do start to show signs before the big problem. So little things, becoming disorganized, not sleeping as much, spending too much money. There's all these little things, little changes. So knowing to look for those and reaching out and saying, hey, I've noticed this thing. I noticed that every evening you're having 2 or 3 drinks, or you're only sleeping 3 or 4 hours, or, you know, what is it that I can do to help you? So that is a good example. Yes?
In my pre-dementia years, for 12 years I was ecclesiastical supervisor for 1,200 professional church workers in Indiana and Kentucky. And during that time, we formed a mental health committee in the district for the professional church worker and their mental health. Because it became evident to us that the pastor, the teacher, you know, is under a lot of stress. And Emmanuel Lutheran Church is very blessed because you have 3 pastors, and they can kind of take care of each other, but they also need you as far as keeping an eye on them as far as that's concerned. Every congregation should have a committee, perhaps with the board of elders, that takes care of the spiritual and mental lives of the pastors and the teachers. Because it's really important, because they too are under stress.
Absolutely.
This last week, we read about the suicide of a youth worker in a mega church in California, world known. So I think it's important that here at Emmanuel, in the last 6 weeks, she's probably had, what, 7 funerals? And you had 3 pastors, and I mean, sure, it was still stressful for them. Think of the congregation that has 1 pastor and has 7 funerals. And that's happening, and the stress that that person is under. And I think probably the most neglected group is also the teachers.
Yes, teachers and any kind of healthcare worker. So professions like pastoral care, being a teacher, being a healthcare worker, we all went into it. It's not a glamorous lifestyle. You know, a lot of people think that nurses and doctors get paid crazy amounts. Most of us don't. You know, none of these professions go into it for the money. They go into it because they care about people. And you see a lot of struggle, a lot of death, a lot of sickness. And with teachers, you see more and more children who aren't getting the proper support at home, and there's nothing that you can do to fix that part, and then it's on you to help these children during the day, knowing that you're sending them home and they don't have clothes and they don't have food and they don't have support with their homework. And so a lot of us do kind of get under or overlooked that we are taking on the emotional struggles of our patients, of our students, of our congregation. Yes?
Pastors are a tremendous resource for referral to these organizations. But
Yes.
even if they refer to these organizations, a lot of people will go to a counseling session once or twice, but then it becomes too expensive and insurance doesn't cover it.
Yes.
And so they say, I'm fine, I'll just go on with my life.
Yep. It is something that our society undervalues. Indiana especially actually undervalues the physicians who graduate from Indiana, from IU. They cannot get physicians to stay from Indiana in the psychiatric field, and Indiana has a program where they will bring physicians over from other countries and send them back through school, because we cannot get physicians that will stay and provide mental health services in Indiana, because the reimbursement rate is very low. Most people who receive services have some kind of Medicare or Medicaid. The paperwork is too much and they don't want to deal with it. And so there's not enough providers for services, and the services that are out there, most insurance companies do not reimburse. And so it is something that is very undervalued in our society. And so advocating for that in a way that you can is helpful. Because, like you said, most people can't afford services, or there's not services provided. Yes?
Victoria, I perceive that this is, I probably already know the answer to this question, but could you talk a little bit about heredity and its relationship to mental health? I mean, if you've had several people in your family, like maybe an uncle, grandparent like that, would it not be more common for you
Yes.
to suffer from mental illness?
Yes, so like any other disorder, when we see that, you know, you've got three grandparents with heart disease, and one of your parents, so we start to really watch for your heart. When we are asking about things like this, a lot of times we do see parents that had depression, an uncle that committed suicide, all of these things that start to trend, and some of that is a genetic component. So if you have somebody that has, you know, bipolar depression or schizophrenia or anxiety in your immediate genetic makeup, you are definitely more likely. It doesn't mean that if your grandpa had schizophrenia that you will have schizophrenia. It's a kind of a all-encompassing thing that when we do see family members that have a lot of mental health issues, a lot of that is passed down. Some of that's genetic, and some of that is also environmental. So the person who was raised by a parent with severe depression is not going to have those coping skills because the parent never had them to begin with. And so learning how to kind of grow up and survive in that environment oftentimes shapes how you think and how you feel and how you react in your internal monologue. So there's definitely a genetic component and an environmental component to seeing family members that all have kind of multiple conditions.
Thank you.
Mm-hmm. Anybody else? All right. Oh, yes.
Well, that's just why pain. And when something gets started, like we doctored at the doctor in the clinic, he took a job at the hospital because he said he couldn't afford to live or run his office on what Medicare will pay versus what he wanted to charge.
Correct.
We all get, when we go for doctor's help, we all get a bill that says, this is what your bill is, but this is what we're going to get.
Yes.
In listening to some of the political movement that's going on by numerous people, it sounds like it could even get worse if we go socialistic type thing. How do you stop a snowball rolling down the hill, just getting bigger and bigger? How do you do to stop something like that that's not even in something like my, I don't know how you do that.
I don't either, and if any of you know, then let's fix it, because it does impact patient care, but it also impacts the desire for anybody to go into medicine. So right now the nurse practitioner kind of movement is blowing up and being huge because there's not enough family practice physicians. So physicians are not even willing to go into medicine anymore and go into family practice because it currently family practice physicians and physicians overall have one of the highest suicide rates. So there's a huge target from Parkview to try to address that, but a lot of it is administrative issues and loss of autonomy. Physicians can't practice the way that they used to. So we all used to go to our doctor, and it was a privately owned doctor's office, and the doctor could be in charge of his nurses and his medical staff and decide how to charge you and what to charge you and what medicines to give. And most of that is now dictated by insurance companies and administrative officials. So if you are at a Parkview or a Lutheran office, which most many of you are, those doctors don't have any say over their offices anymore. They are not in charge of their nursing staff. They are not in charge of their medical assistants. Those are all run by office managers. And so all of that is just kind of this administrative, corporate mess.
Well, we're seeing a bigger move to PAs with physical assistants.
Yeah.
And we're talking with one that she's even got another job somewhere else to support being a PA. You know?
Yeah.
Kind of crazy.
It is. So we're all in that same boat. There's not a lot of positive ways forward currently. So, anything else? Thank you all for your time. If you have any questions,
I want to thank Victoria for sharing that with us today, and we recognize that, yeah, we want to re-emphasize that as God's people and as a family of Christians here at Emmanuel, if there are challenges, let's go to each other, come to your pastors. We'll gladly, we aren't mental health caregivers, but we can direct people to those people who are so gifted and people who have a Christian orientation. So, you know, we hope this opens the door for some of that opportunity for conversation. So, and you can always go to Victoria.
you can always come to me.
She'll be here every Sunday, so you can go check her out and talk to her. Yeah, get free.
I do get lots of phone calls on a weekly basis, which I am very grateful for, because I do like that people feel like they can reach out and ask questions, and if I don't know the answer, 9 times out of 10 I can at least get you pointed in the right direction.
Well, thank you very much. We have to